When we think of a cancer biopsy, we think pain, needles, anxiety, surgery. What if tracking a tumor's response to therapy is as simple as breathing? Welcome to the science of exhaled breath condensate, EBC. By cooling the air that we breathe, scientists are capturing microscopic droplets of the airway lining fluid, giving us a quick snapshot of what is happening deep inside our lungs and on the surface of our lungs to capture lung health. Let's look at a real-world example of how EBC is being put to the test. One of the greatest challenges in treating lung cancer with thoracic radiation is a condition known as radiation-induced lung injury. Too much radiation can cause irreversible scarring or fibrosis, which can either mask the presence of recurrent cancer on CT scans or augment quality of life, or can augment how much a lung can receive in the future if radiation is needed again. A landmark pilot study tackled this exact problem, and this was actually a part of my doctoral dissertation, where researchers analyzed EBC from patients who underwent radiation therapy and compared it to healthy control subjects, those with an extensive smoking history, and those who were diagnosed with lung cancer but had not yet undergone radiation therapy. What we found was incredibly striking. Patients who had undergone radiation therapy, who had then developed this radiation-induced lung injury, had a unique metabolic footprint that wasn't only distinct from someone with a healthy lung, but it was distinct from an active smoking history, and it was distinct from an active cancer diagnosis. The EBC from patients who had this condition had a massive spike in lactic acid, as well as other metabolites involved in energy-producing processes in our cells. Essentially, in patients diagnosed with radiation-induced lung injury, we hypothesized that radiation forced these cells in the lung to enter a state of metabolic distress, where cells were forced into an energy-producing state in order to overcome the injury caused by the radiation. This led to more scarring, more fibrosis, and more disease. So EBC served as a direct, non-invasive window of the cellular damage as it was actively happening.